Okay.
Morning, everyone.
Good morning.
Good morning.
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 Hello, I am Deb Stidham, and I serve as chairperson for the Kansas Behavioral Sciences Regulatory Board. I ask the members of the board to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic medium. David Anderson.
Present.
Daniel Johnson. Mary Jones.
Present.
Jacqueline Lightcap.
Here.
Jonna Norton.
Here.
Bruce Nystrom. Andrea Perdomo Morales.
Present.
Leslie Seawester.
Here.
Laura Shaughnessy.
Here.
Rick Steele.
Here.
Carolyn Zasfran.
Here.
I note the following staff members are also present. David Fye.
Here.
Leslie Allen.
Here.
Cindy Diorkel.
Here.
Ashley Van Buskirk.
Here.
Assistant Attorney General Janet Arndt and Lainey Bernard, who are assigned to the board as general counsel, are also present. David Fye will read a message next concerning this meeting being held remotely.
I am David Fye, Executive Director for the Behavioral Sciences Regulatory Board. Public comment allows the public to address the board about its concerns, but the Kansas Open Meeting Act, or COMA, does not require the board to provide public comment or answer questions from individuals. Public comment could be requested by individuals contacting the Executive Director of the BSRB prior to the meeting, requesting to address the board by providing public comment. At the meeting today, one individual has been scheduled to provide 5 minutes of public comment to the board on the topic of title protection for social workers. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. Because the emergency declaration that was issued for the COVID-19 pandemic has been extended to May 28th, 2021, the meeting is being conducted remotely to comply with health and safety concerns, as the board's conference room cannot accommodate social distancing for everyone in attendance. However, access to the meeting is being conducted by a medium of interactive communication that allows members of the public without cost to attend the meeting through the use of conference call and on the board's YouTube channel. While the meeting is being conducted remotely, the requirements of the COMA are not suspended. As such, we'll be conducting the meeting pursuant to COMA and KAR 16-20-1 concerning compliance with the COMA during the existing emergency disaster declaration. On April 14th, 2021, notice to all individuals who had requested notice of the meeting. The notice was also posted on the board's website, bsrb.ks.gov. You may obtain a copy of the notice at the website. Agenda and other meeting materials was posted to the board's website on the day of the meeting. You may also request a copy of the agenda by sending it to david.fye@ks.gov with the subject line request for the agenda and be sent to you. The notice contains information from the call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are technical issues during the meeting, you may call the board office at 785-296-3240. Each member of the board, staff, and presenter shall state the person's name and each time the person speaks or votes. Each participant to the meeting shall use their phone or other electronic devices when the participant is not speaking. Each motion will clearly state where the board votes, and each board member will vote when their name is called. The chairperson will announce the result of the final vote. A statement or motion will clearly identify each member of the board or staff who the board delegates its authority to sign any binding documents on behalf of the board. A recording of the meeting will be posted to the website. The board has the following on the agenda: call to order and roll call, opening remarks, approval, minutes approval for previous meetings, public consideration of proposal for application education services review, executive session, executive director's report, staff reports, new business, old business, complaint review committee report, professions report, information on July board elections, and adjournment. The board's agenda does include an executive session. If the board elects to go into an executive session, the board will follow this process. First, the board must be in an open meeting before going to an executive session. Then the board member must make a motion to recess for an executive session that is seconded by another board member. Each board member will then vote. A majority of the board must vote in favor of the motion to exercise the executive session. The chair will announce the result of the vote. The motion must contain a statement of justification for closure and the subject to be discussed pursuant to KSA 75-4319B, and the time and place the open meeting will resume. If the motion for executive session passes, the conference call will be placed on hold. Attendees may stay on the call or return to the conference call number at the expiration of the executive session to attend the remainder of the meeting. The public will be excluded from the executive session portion of the meeting, as the executive session will be conducted by electronic means that is not available to the public. When the board members return to the conference call, the open meeting will resume through the conference call. The complete motion for executive session will be recorded in the minutes. And Deb, I just want to let you know that during the reading of this information, Bruce did also join the call on the Zoom.
I did note that. Thank you. Also, David, just so you know, there was some cutting in and out while you were reading that script. So I don't know if it's just keeping your head towards the speaker, the microphone. I don't know. Or maybe it was just unstable internet, but a couple of us noticed it. So, okay.
Thank you.
Hopefully that was momentary. All right. Hopefully everyone received the agenda. And I would entertain a motion to approve it unless anyone has any changes or additions or.
So moved.
Second.
Thank you, Leslie. Thank you, David. All in favor, say aye.
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 Aye. Any opposed?
Aye.
Okay. Next on the agenda is to approve our minutes from our previous meetings. We are a busy group here. So if you'll direct your attention to the March 8th minutes. I actually have a notation of, it's just, I'm sure, a transcription error on page 3 under COVID-19 vaccine, about the 4th sentence down. So I think it should say that employees are not required rather than that not employees are required. I think. I don't know, unless we're talking Old English.
That's how I like to write.
Probably no employees.
There you go. That would also make a more likely
March 8th.
scenario.
With that change, I would make a motion to approve those minutes.
Do I have a second?
Second, Jackie.
All in favor, say aye.
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 Any opposed? Okay, thank you. Where's my paper here? Next minutes, March 10th.
I would also make a motion to approve the March 10th minutes.
Is there a second?
This is John. I will second.
Thank you. All in favor, say aye.
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 Any opposed? March 15th minutes.
I will make a motion to approve the March 15th minutes.
Thank you for moving us along, Mary. Do I have a second?
Second,
Who was that?
Andrea.
Donna? Andrea. Thank you. All in favor, say aye.
Aye.
Aye. Any opposed? And then April 2nd minutes. Have a motion to approve as written.
So moved. This is Leslie.
This is Carol.
Second.
Seconded.
All in favor, say aye.
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 Any opposed? Okay, we are ready for public comments from Sherry Kuchel. I hope I said that anywhere close to correct.
You did. Good morning. Thank you for allowing me to speak briefly to you all. I know you have a full agenda for this morning, but I briefly spoke last month or the month before, I don't know, but for some of you, maybe you don't know who I am, so I'll just briefly tell you. I'm currently the president of our Kansas School Social Work Association, KSWA, and I'm a retired social worker. I had 8 years with way back when, SRS, now DCF, and then 24 years as an elementary school social worker in the Manhattan-Ogden School District. But I really wanted just to spend some time talking to you and expressing our concerns as an association, and also, I guess, as a professional and just personally about the hiring of unlicensed individuals as school social workers in the state of Kansas. And then also the hiring or potential hiring of BSWs in our school districts, that really the work, the scope of the work, scope of practice is really at an MSW, licensed MSW level. So those are really the two concerns, the unlicensed individuals, and then just LBSWs being hired really out of their scope of practice. They don't have the specialized training and knowledge of understanding of the educational system that you get in the 1 or 2 years of your master's program. So with just talking with school social workers around the state, they have expressed their concerns to their administrators. Just nothing is changing. And we have districts around the state right now that are getting ready in the process of hiring, and they are, accepting BSWs, and that's just concerning. So I guess we really would like for some assistance from BSRB. And our association's been working with KSDE by compiling some information to send out to administrators. I just think it's really a lack of knowledge on their part. They really maybe don't know the difference between the degrees and the specialized training. I don't know exactly what their reasoning is, but wanting to see if BSRB would be willing to put some information together regarding the different levels of licensure, talk about the statute of the use of title, that you can't be called social worker if you don't have A, B, and C, so that we could then either KSDE or Case Law could send that out to administrators so they could be informed. And I just think if there was something that looked really official from you all, that maybe it would carry more weight than a school social worker just expressing their concerns. So yeah, so that's kind of it in a nutshell. So again, I appreciate your time. I know you're busy. Be open to any questions or thoughts regarding my comments.
Sherry, Deb Stidham, I have a question. As I consider the parallels between social workers and addiction counseling, particularly since addiction counseling did not have licensure, right, until some time ago, like 2011. So we had a lot of folks doing that work, and potentially, and probably still folks doing the work in certain settings that probably aren't licensed. The kind of the way that this gets caught, if you will, is primarily through audits and contractual arrangements, right, that require that more so than anything that the scope of practice for addiction counseling requires. Does that make sense? Or limits?
Yes.
So I totally get title protection. I'm kind of ignoring that just for the moment. So I guess I'm wondering, I hear what you're saying about administrators. I don't know enough about how the school systems work. I mean, it seems to me it needs to be established in some sort of contractual, tied to the funding, that would be the easiest way to like almost forever ensure, that, I don't know, folks get it, if you will, because that's partially how it is enforced in the addiction counseling realm, is that the funders require it. Does that make sense?
Yes. Yes.
Because at the more local level, the administrator, those change hands. There's that, subject to interpretation. I suspect this is tied to a larger workforce issue that we're having across, a lot of different systems. Certainly, any behavioral health work where there's just kind of a lack of applicants, and where you have tighter funding streams, which is what everyone's also experiencing. There may be a reticence to hire those higher levels. So I'm not saying that excuses it. I'm just saying there's a lot of competing factors here. But without that tie of accountability, I guess I worry that you could put something in place now, but or get some folks to say, oh my gosh, that's right, I shouldn't do that. But it feels like this is a very high level state government putting it into, institutionalizing these
Right.
definitions. I don't know, that's my thoughts on it.
I will say I did some research on number of social work graduates, and there is definitely not a shortage. The state of Kansas is graduating over 300 master level social workers this month. So there's not a shortage. So people can't say, administrators can't say, well, there's just, because I know that fact, and I know there's districts where there have been MSWs that have applied, and same with the BSWs. So I agree. I think it definitely needs to be at a higher level, but I guess we're just concerned about now because there are districts that are hiring now, and even if it's just, it doesn't have to be anything at that high level, but just something coming from BSRB that says these are the different levels of licensure. I don't know. I think if a social worker could show that, or KSDE could send that out to administrators, they might be more willing to accept that. It should make a difference.
Right. So everything that I've heard you talk about so far, and I'm not trying to be argumentative, I'm just trying to understand, where's the leverage? So everything I've heard you talk about so far is that it would be best practice to hire an LMSW because of the training. Are you aware, and I'm going to throw this out to the staff and everyone else, what is in our scope of practice that actually prohibits a BSW from taking a job that is better, if you will, for an LMSW to have? Is there, because that's what we have to look at. What does the rules and laws say? We can put out something that talks about this would be better, but I don't know that there's anything illegal, if you will. Is there?
Right.
I don't know.
Yeah. And I have looked through your regulations and statutes. I've looked through our, NASW Code of Ethics, the NSW school social work standards. And the only thing I can find is that it is strongly recommended. So again,
Okay.
There is no law
that
says, not in Kansas anyway, but yeah.
Deb,
So
this is the person who is licensed as an LBSW would be under unprofessional conduct, and if they're practicing outside of their scope and training and experience, they would be violating unprofessional conduct. That's the only thing I can think of.
That was going to be my question. This is Leslie, because what I was understanding is Sherry is saying that it's the schools that are hiring in the wrong level. But I also thought, well, if the social worker as a BSW is going in willingly, knowingly going into a position that they know is MSW requirement licensure, then that would be a violation. So I guess there's two sides to this, I think, that we're kind of looking at. I can't figure out as a board.
Where is it stipulated that that's required?
Right.
That's the problem.
Well, and I think it's tricky too. This is Andrea. I think each school district is doing it differently. I know that there are several school districts that their social workers in their school are doing mostly resource coordination, resource linkage, which would fall in the scope of a BSW. So I'm not sure how to then understand what each school district is doing and how they're going to utilize social workers, whether BSW, MSWs, in their roles.
So this is Cindy. Does KSDE have any statewide requirements for social workers, school social workers?
No. school social workers had in the past had been certified through KSDE, and that was dropped probably 20 years ago because it was a duplication of what we were doing for you all, for our license. And we were not, there was no benefit other than we got to sit through 6 trait writing skills and those kinds of things that didn't pertain to us. So we are working with KSDE, and I think they are finally going to put some kind of mental health, linkage tab on their website, then which would go to case law and to social work resources. But one of the things that is special education. I know in the district that I was in, we did not have counselors, and I think that's another whole issue that I don't think administrators understand the difference between a counselor and a social worker. They think they're kind of both the same, and they're not. We have very different training, different licenses, and so, but that master's level social worker in a school can do those assessments, special education, IEPs, and provide those kind of services. So that's a huge difference. And then again, that would be out of that scope of practice for the BSW, which then would, and social workers have, I said, well, why don't you report this to BSRB? And they said, well, we looked into it, but you cannot report anonymously. So they were concerned about, which is very true. You report your district for doing something unethical, it's going to be a hard place to work. Come back the next day and work. So, they've looked at that and thought that seriously about reporting, but because of the requirement to do it, to have your name and all that, they aren't willing to do that. So. I don't know.
This is Carolyn. Sure, I understand that for sure, that tough position, but again, I think we're obligated to report when, but I could certainly see the difficulties. It is rather confusing. When I worked at Washburn in the internship program, we had both levels, BSW and MSW school placements. We also had a specialized track, an MSW track for those students that wanted to get their MSW, and for those students that wanted specific social work practice. And we had special classes they had to take. I don't know that all universities does this, but it almost seems like we need special statutes and regulations pertaining to just school social workers, because it's different than just, there's definitely confusion.
I would agree, Carolyn.
We
are, we're under the umbrella of social workers, but we are a different kind of entity.
Yeah. And I agree that, our program, at Washburn felt that there was a different level, and that's why we had the MSW, kind of certification process, but again, I think Andrea was saying all universities are a little different, and that makes it even more complex too.
Right.
Understanding this.
Right.
This is Cindy. Are any of the districts hiring people that are unlicensed and calling them social workers, school social workers?
I believe that has happened. I don't know if it's currently, but I know that's happened in the past. Mm-hmm. There's just a lot of haziness around the whole school social work, school social worker. And I think I mentioned this last time. There's districts that are calling them family liaisons or this or that. And it's like, that's what we were talking about earlier, is that no, we're a school social worker. That's what our degree is. That's where our training is. And that's what we want to be called. So I don't know. I just think anything that you all can provide us, just like KSDE is, to encourage or to recommend something to administrators would be helpful.
And then once, if we were to do that, then you would send that out, or you want us to, or how is that going to work?
KSDE, Shauna Bigler, I think is her last name, is the mental health liaison, and she's actually a board member for case law. So she has that listserv of all the administrators. So she would be the one to send it out. I mean, I would like a copy of it just to put on our website and stuff like that. But yeah, it would be her that would send it out to administrators.
And so I'm understanding your request. You just would like for us to compile what scope of practice? Like, obviously it would be some sort of regurgitation of our rules and statute.
Correct. But in a way that—
Is that what you're asking?
Yes, in a way that, you know, someone that's not familiar at all with BSRB or a school social worker would be able to understand. So, yes. And, you know, and maybe throwing in something about, you know, the statute 65-6307. Just including that too.
Yeah.
I'm just curious if this at all falls under what David and Leslie do as far as when they go out and talk to schools or other entities. Would it be something that could be somewhat resolved through education by going out and talking to them as an executive director and doing something along those lines? Just a question, I guess, for the board and for David and Leslie.
It's not something that we currently speak to. Usually we're speaking to students who are graduating and just doing the licensing process and a little bit about disciplinary, but you know, nothing that goes that deep into one specific topic. Not that we couldn't, but it's not.
This is Carolyn. It seems like the communication should be through the school district administrators. You know, if you do it individually, there's going to be a fragmentation of, you know, that communication line. I think that basically, you know, like USD 501, you'd go to the, you know, the administrative level to communicate with that district, and then you do district by district, you know, and then they would channel that information down to their.
I think if we started with the KSDE and maybe, you know, going out in groups and then, you know, having those conversations is what I was thinking, Carolyn, not necessarily to each individual student, but maybe to the groups that we're referring to, the KSSWA and the KSDE, maybe coming from, you know, David and Leslie and representing the board. So I think we're all on the same page.
Yeah, that's a good.
I know in our area, because of workforce issues, schools have gotten waivers to hire people into positions who are not technically qualified for those. I don't know if that impacts these positions as well, but I know it does for school counselors.
Which begs the question to me, who's providing the waiver? I mean, I'm not sure what that really means unless they've changed the scope of practice.
And I have not heard that anyone's providing waivers, because again, there is not a shortage of, you know, MSWs that are graduating. It's, yeah. So
but they might not be willing to move to the rural and frontier though, Sherry.
Yeah, I have several counties that would strongly disagree with you that they may exist in the state, but they don't exist in our region.
Yeah, I'm not willing to move out there.
That was actually a question that I had as well. I wondered if you did notice this happening more in predominantly rural districts, or did you notice any certain districts that this happens in more than others?
I think it's rural districts, probably the majority, but there are in some districts that I would not consider rural that it's happening.
Okay, I was just trying to see if that might be a workforce issue in relation to occurrence. That's all. Thank you.
And I really think it's just an education issue that these administrators don't know. They just truly don't know. They don't know even what a social worker, and then all of a sudden they're thinking they need to hire one. They're somewhere along the line, their school board or somebody told them they needed to hire a social worker, and they just don't know. So.
Well, I'll throw it out to the board. Is this some action we would like David and Leslie to follow up on, to create some sort of letter that would go to school administrators explaining the scope of practice? And I think certainly to add at the bottom of that, for them to reach out, they can contact either the BSRB office or Carolyn or Andrea for any more follow-up questions.
Yeah.
And I think what I'm hearing is,
Go ahead, Deb.
all I was going to say was I'm hearing their time is of the essence. So while I'm certainly appreciative of face-to-face conversations, I think if we're trying to impact hiring for next year, we better just get this letter written and out and then try to follow up with some discussions, particularly if folks want us to do that, which they may not in all cases. So go ahead, Andrea.
Sorry. No, I would agree, Deb, including the scope of services, what you outlined, and then also including the title protection piece in there, and then continue to have conversations with KSDE. This trend, if you will, of hiring social workers in school districts is not going to slow down. It's only the beginning. So I think it would behoove us to kind of get ahead of it a little bit.
And I think it's happening in other, types of practices, child welfare, we're seeing this happening. But yeah, I would agree with Andrea, and Deb that a letter would be a good place to begin. If David and Leslie agree with that.
So when I read the statute, not a social worker, I don't believe the statute, the definition of social work is very specific. It doesn't say a BSW can do this and MSW can do this. The only thing it takes out is diagnosing and treating for LMSWs and LSCSWs. So I don't think there's much statutory language that we could put in a letter. But again, because I'm not a social worker, maybe I'm missing it.
I think just even that, Leslie, as a starting place would be helpful.
Well, I guess what I'm wondering even under that, because what I'm hearing in some cases is that they may be inadvertently hiring BSW staff for positions that might look more like assessing and counseling, and which would, I'm just wondering if we could operationalize that distinction just a tad bit in terms of how it tends to show up in these kinds of non-therapy roles. I don't know, just a question. That's what I was afraid of, is that the statute was not, for addiction counseling, it's pretty specific. But I always have known just in general that social work was intentionally written broadly, which certainly leads to these questions. So Leslie, what I hear you saying is that you're not sure the letter will really mean a whole lot.
I'm not sure that I personally could put a lot of statutory reference that would help. Yeah.
That it's the difference between it says is diagnosing and training, and that if someone's going to be a social worker, if you call someone a social worker, they have to be a licensed social worker. That's the statutory or regulatory language. And Jan, please stop me if we are incorrect. That would be what you would say, would be the two references that you could say.
I can't specifically say what an LBSW can do. That's what
right.
I can say that an LMSW can diagnose and treat. But other than that, I don't have much to add.
No, I think that's
okay.
That's not minor.
It is
honestly.
important that if you call someone a social worker,
no,
you have to have a license.
Right, that's title protection. So we have that.
That's.
And again, I don't know if you could just, add a little bit about, that BSRB would strongly recommend. That's what our NASW school social work standards say. It's that an MSW degree is a recommended entry-level qualification for a school social worker.
I don't think we can do that. That would be up to Jan, because our statutes don't say that. So the board can't recommend, my understanding, we can't recommend anything that's not in the statutes or regulations.
Oh, okay.
Right.
Jan would have to help, I guess, make it as broad as we could, but but I don't think we can recommend. It would be up to, you know, the school district or whoever, the Department of Education that would, you know, make that more clear. But I don't think we can.
Right, so we've gone full circle. So Sherry, what is the conversations occurring with KSDE and their willingness to look at prescribing a bit more pointedly about what they expect out of these hires?
Well, again, it goes back to, you know, we keep hearing, well, we're not certified through the Department of Ed, so they don't really have any authority to, you know, again, I think they're more willing to say, you know, I recommend or we recommend. I think at this point, we're just trying to flood information the administrator's way about just different types of services and what the role of a counselor is, a psychologist is, a social worker is, and hope that through that information that administrators will see. Oh, but then again, if they don't know what the difference is between a bachelor's level and a master's level, that's going to be kind of meaningless to them, because they're going to think, oh, a school needs this, and this done. Well, this person can do it. So I think at this point, we're just wanting information out. And as an association, we're going to be doing a lot, to try to get that information out too.
Sherry, have you been working with the NASW, the Kansas NASW?
I have not, but I can definitely,
A good suggestion.
Yeah.
This is Mary. Outside of the title protection, I'm just not sure we have anything to chime in on here as a board, and I'm not even sure this is the right juncture to do that. So I'm not feeling compelled to take action.
I don't think it hurts to send a letter, you know, just reviewing the statutes, and like Leslie said, as long as we don't strongly recommend anything. So I'm supportive of a letter going out, even if it's just to Sherry, that she can share with whomever she would like to share.
This is Carolyn. I agree with Leslie. Good starting place for discussions.
This is Danielle Johnson. I agree.
So are we going to start sending out letters to all employers? Or are you just talking, I mean, why? You're kind of starting down a slippery slope.
Yeah, I agree with Mary's position. You know, I don't even know what that letter would say and how it's going to inform administrators who don't already apparently understand what these people are supposed to be doing. It really is incumbent upon the people taking the positions to practice within the scope of their training and their licensure.
Yeah, I think I'm similarly, this is Rick, I'm similarly confused about exactly what that letter would say, other than just repeating the statutes, which are, I just looked them up on our website, and I feel like this could end up coming back and being something we can't really manage as a board.
Okay, well, we got kind of a split opinion. I guess if anyone feels at this point in the conversation prepared to make a motion to take action, then I'll entertain that to see where it goes.
Can it come from the advisory committee?
I think my only comment back to that is, what's the difference?
Well, they seem to feel strongly, that particular group feels strongly.
Oh, I see.
About this.
You're right. Yeah. There was a
Versus,
couple of social, yeah. Carolyn and Andrea.
So meaning that we would bring the recommendation from the Social Work Advisory Committee back to the board?
No, I think what he was suggesting was just you all craft the letter if your committee agrees.
But then it would come from.
I didn't think advisory committees could act on behalf of the board. So
That was
They're still representing the board, so it's no different.
That's what I was
okay.
thinking.
I mean, I think if we don't have consensus, then maybe the advisory committee advisory committee, would we be able to work with Sherry and the Kansas NASW, and maybe Kansas NASW be the one to submit that letter?
And for those people that can make recommendations or can develop standards, for those to be the people to report, the associations to report. Yeah.
Yeah, I think some further analysis of like what would be a solution to this. I'm still back to KSDE or some mechanism like that. The school system is funded by state general funds. I mean, if someone in charge in state government can't decide to illuminate this further in some way, I don't know what possible leverage we have about anything, honestly. So, but they're going to have to decide this is enough of a problem to take their attention.
Regarding the hiring of non-licensed social workers, title protection, someone has to report that, to the board. And I understand the tough position, but there's really nothing we can do unless that information is given to us.
And not by the school district. It needs to be specific licensees or non-licensees who are practicing.
Right.
And then the reports of alleged violation directly to that person, not the district or the school.
I mean, I don't know what the membership in KNSW is, but if it's significant, I would think a letter out to all the licensees would be a good forewarning that they need to be mindful, particularly since the statutes are not written super specifically about the kinds of jobs they're taking and their scope of practice, or they may very well find themselves with a unprofessional conduct charge.
Okay.
All
That's a
right,
good idea.
Sherry?
Yes.
Well, thank you for providing your comment. It was a good discussion.
Thank you. We're well over 5 minutes. I apologize.
No, that's fine. We took the time.
Thank you for listening, and yes, I appreciate your help.
All righty. Thank you, Sherry.
Bye-bye.
Okay. Next item, consideration of proposal for application educational review services. I think Tammy Lee is with us.
Yes, I am. Good morning, everyone. Thank you all for the opportunity to speak with you for a few minutes regarding the proposal of CCE performing the education equivalency reviews for your non-KCREP applicants. Just to give you a little history, CCE that was established about 26 years ago. We do different aspects of things, but the thing that we're focusing on today is the educational review services. Currently, we do the review services for 5 different states, Colorado being our oldest state that we've performed reviews for a little over 20 years. Right now, we are currently doing the education reviews for the licensed professional counselor, the marriage and family therapist, the addiction counselor, and the psychologist. So we're performing those reviews for them. South Carolina is our next oldest, and we do the licensed professional counselor, marriage and family therapist, and the addiction counselor. Iowa is another state that we do the mental health counselor and the marriage and family therapy for Iowa. Florida, we just do a straight transcript review for them just to make sure that the graduate has completed their counseling program, and North Dakota for the applicants that have not that did not attend a KCREP accredited institution. So just to let you know what we do, we actually do create an internal checklist according to the rules in your rules. So the 9 core content areas that you require for applicants to have with the education. We check their transcript. So we do require that they send us an official transcript and the course description so we can review that to make sure that the courses that they took included the material that would fulfill each one of the content areas. We ask for the course descriptions or the syllabi because a lot of times you can't tell by the title. So that's why we do require that they send that to us. Once we do that review, we send out a tentative if they are deficient in any of the areas. What we do, we send a letter to let them know which areas, to let them know we did the review, but they are deficient in the certain content areas that they would need to go back and actually take a course to fulfill that content area. But we do recommend that they send us the course and the course description before they enroll in any course, so they're not wasting their time, just to ensure that the course that they enroll in will indeed fulfill that content area. If their education fulfills each one of the content areas along with the practicum and internship course, we will send them a tentative approval letter because we let them know your education has been approved, but the board makes the final decision as to where the licensure part of it. But we let them know that we have granted them a tentative approval. Once we do that part, we send the letter to them. We send the entire file to the board. Now, since we've started COVID, now all the states that we review for now, we upload the applications to a secure portal instead of shipping them. But we're willing to do whatever works best for you all. As far as the payment part of it, I think I've discussed this with David prior to the meeting. The applications that we have, we put them on our website. So applicants that apply with us, they download the application from our website and they send that in to CCE along with the payment. So all communication during this time is between CCE and the applicant. I think you all probably want to handle yours a little different. We will modify that whatever suits you all best. So that's something that can be changed, but that's currently how we're doing with all of our states. So except North Dakota now. In North Dakota, what we do, because they don't have as many applications per year. So when we review, because I personally do the review myself in North Dakota. So they send me the application, I do the review, and then after I do the review, send the letter back, let all the information back to the executive director there along with the invoice. So I invoice her and then she sends the check back to CCE. So that's how that's handled. But that's the only state that handles it a little bit differently. Everyone else, they complete the application, they send the payment in to CCE and we process the payment and we do the review, and any communication between the education and questions they have about the education is between the applicant and CCE. So the board does not have to get involved unless they want to appeal. So with every application we put on that, every candidate has a right to appeal. So, and that's when, if someone wants to appeal, they send that in writing to us. What we do, that's when we contact the board, let them know that person wants to appeal, and we send the entire file to the board for the review at a board meeting. So that is basically what we do for as far as our review services. And I know that was kind of quick. So if anybody has any questions, I want to give you time to ask any question that you may have about what we do. But again, we've been doing this for over 20 years, and I'll be happy to provide any references if necessary. And again, I want to open the floor for anyone that has questions about our processes.
Thank you, Tammy. I have a question about that appeal process. So in the event that it would go all the way to court, is your group prepared to provide expert witness testimony?
What we do, we've not had that experience, but so that would be new to us, but we'll be happy to do that. But we've not had it. It's always been to the board because we always tell them that the board has the final authority, so whatever determination you all make with the appeal, whether, they said, well, we're okay with that course, with what they provided, or, we're denying it. We've always just let them know that the board has the final approval of whether, and so whatever you all determine, that's what goes. So we've not had that experience, but we'll be happy. I mean, that is something that we'll be willing to do.
Other questions for Ms. Lee?
This is Rick. Hi, Tammy. Thank you for being here today. I had one question about the review. You mentioned a couple of times looking at the course description or the syllabus. In the way you think about that, are those two different things? So the course description is what appears in the catalog, and then the syllabus is actually what theoretically was taught?
Well, sometimes in doing this, we get a course description, but it's only like 2 lines. So that's what sometimes they can send that if that's all they have. But if we need further information, that's when we do request that they send us the syllabus so we can have a full, look at it to make sure that it really contains the material that's needed to fulfill the content area. So then that's the only time we do that is if they, if it's like a two line description, they're really not giving us the information that we need.
Okay, thank you.
Tammy, how long do these reviews normally take? I think I saw something in your contract about $150.
Yes, the price is $150, and we do perform the reviews. It could be anywhere from 2 to 4 weeks, but we try to, for 4 weeks, be the maximum.
Right. Oh, so we're just paying you for the review itself is $150. Is that what?
Yes, that's to review
okay.
that.
Okay. I didn't know if it was an hourly rate or what.
Okay. Oh, no.
Okay.
That would be.
And you answered my second question was how long does it take you to process an application? So
it's 4 weeks after the pay clears is what we try to turn them around quicker than that, but 4 weeks is like our maximum.
I think it says 6 weeks in the statement of work.
Yes, we have already, because right now Michigan has already written it into their rules. So we're going to start doing for Michigan. So I'm hiring another reviewer. So that would cut down that time.
So Tammy, I know that this particular board is unique in that we have so many different licensee types. So can you speak to your experience in dealing with all of the disciplines with the BSRB?
Now, I'm not sure if all of you, I know David spoke to me about the licensed professional counselor, and I think he's mentioned addiction, and we do addiction now, like I said, for Colorado and South Carolina now. I'm not sure the other ones that you might, but like I said, we're currently doing them also for psychology and for marriage and family therapy. So we already experienced with all 4 of those. And
social work?
And we have not done social work, but that's just a matter of no one has ever, contracted with us to do that. But that is something again, everything that we do, we just go back and we study and we make sure we understand all of the rules of everything before we, but that's something we definitely can do.
And how many states do you currently contract with? Maybe if you said that, I'm sorry.
It's 5 right now, and with Michigan, it's already written. They just have to finish up with their legislation, but it's already written in their rules. So it'll be 6 with Michigan.
Okay. Okay.
I have a question.
Sure.
Go ahead, Laura.
What are the credentials of the people who do your reviews? What are their backgrounds and training?
Okay, but I started out with that, and right now I have an MBA, but I started out with that. I just had my bachelor's. The reviewers we have now one has a bachelor's, one has just a 2-year associate, but they're all trained. They're all trained. We go through a training period, and they're right here, and I work with them every day, so they're here with me. So just in case they have any questions, but we do make sure that they are totally trained and fully understand, what they're doing. So I look at these before they go out the door, especially when they're new employees. Definitely we have to review those and make sure that everything is appropriate before we send it out, because we definitely don't want to tell someone that they don't meet the requirements or they go take a course and, because, we don't want to make that mistake, because that is very expensive. And so we definitely want to make sure everything is right before it leaves our building.
Thank you. Do you have clinical staff that you can consult with if you have questions?
I don't have a clinical staff here, but we do have within our organization, we do have several, our president CEO actually is a counselor, Dr. Kylie Dotson Blake, and we do have several other LPs, NCCs and counselors on staff here. So any questions, we work as a team. So if there's anything that's ever hard, we definitely will pull in the resources we need if necessary, when necessary.
Terrific. Thank you.
Tammy, do you have any stats on what % of your course reviews, or let's just go to the applicant level, you end up denying?
It depends on the state. So really I don't, but I can get that information. I can get that to you, those numbers to you, and send them to David, and he can disperse to you all. I can definitely get that done before the end of the day.
Okay, thank you. Any other questions, board members?
Sorry, this is Dave Fye, Director. So Tammy, we spoke about this previously, but I think it might be helpful for the board to have this information clarified too. When you mentioned the general practice of your company, you described as sort of the method that you work with a lot of different states in terms of the applicants having the arrangement where they contact directly with your company. I think what we've talked about as a potential possibility would be more similar to the North Dakota model, where they would send you certain applications that were individuals who had attended their education from a non-accredited or an institution that was not accredited by the professional or national accrediting body. In terms of the billing, could you just clarify if there is a minimum amount that, if the BSRB contracted with you, if there's a minimum amount that would be billed, or if it is separate per review that takes place?
It's per review. It's per review. So if I only receive one application a month, then you'll just get that invoice for that one application. So it's not an hourly or a flat fee. It's the $150 per application that we receive to review. So that $150 is covering that review service for just that one application. So for each application, we'll just, after the review is done, we'll invoice the board back for that fee, for that application. I hope that covers your question.
Thank you.
Okay.
Any other questions? All right, I think that concludes this portion. Thank you, Ms. Lee. I appreciate your time. We'll be in touch.
All right, thank you so much. You all have a great rest of your day.
You too. Okay, moving on the agenda, I see it's time for an executive session. We do anticipate that session to last a considerable amount of time. What is the board's will? Do you want to take a break at this point?
5 minutes.
All right. You're a slave driver, David Anderson. All right, 11:06, come back after break.
Thank you.
They know they have to come back.
I just submitted them all back in.
Okay.
Yeah.
Looking lonesome.
I should have clarified that I meant I need at least 5 minutes.
Too late.
Deb, I'll need to step off at noon. I'm sorry. I'll try to log back on as soon as I'm done.
Fine. I think we have everyone on today, so we should be okay. He's joining us. We'll wait for a couple more videos to start and then we can get back going.
And I'll just clarify, is there anyone on the conference call? Okay, no. And yeah, in the initial roll call, Danielle Johnson was not present, but she did enter after that. So I just wanted to note that for the audio. So.
Thank you. I did notice that. I think that's 100% attendance today.
Yes.
Good. 2, 3, 4, 5, 6, 7, 8, 9. All right, well, I count 9 that have their videos on, so we're going to get started. Okay, I think David Fye has a statement regarding the executive session.
Yes, and Deb, I just wanted to clarify. So for the executive session, would it be the board prefer 45 minutes for that executive session, and I'll include that in the motion?
Works for me.
Great. Okay. Then pursuant to, I'm going to read this language for an executive session motion, and then I'll ask if a member of the board would like to go ahead and make this motion. Pursuant to KSA 75-4319 B2, the person making this motion would move that the board recess into executive session for 45 minutes and reconvene the open meeting at 11:55 a.m. The meeting will be reconvened remotely by conference call at 1-877-278-8686, PIN number 327072, and at the link of the board's YouTube channel as stated in the notice of meeting that was sent to individuals who requested notice and published on the board's website, ksbsrb.kansas.gov. The justification is closure. Justification is consultation with the board's legal counsel, Assistant Attorney General Jan Art and Lainey Bernard, that would be deemed privileged in the attorney-client relationship. The subjects to be discussed in the executive session concern issues with proposed contracts and requirements for postgraduate supervision hours. Board staff who are included as the client in the executive session are David Fye and Leslie Allen. And to enter the executive session, just go ahead and follow the information in the email that I sent with the executive session conference call information. And then if a board member would like to make that motion, that could be done at this time.
This is Mary, so moved.
Laura Shaughnessy, second.
All in favor, say aye.
Aye.
Aye. Any opposed? All right, so hopefully everyone has access to that email that had that information in it. I know I'm going to have to look it up.
Yeah, David, could you resend that to me? I don't know that I have that quite handy.
This is Lainey. I don't have it either.
Yes, I'll go ahead and resend that email with the executive session information.
Thank you.
And it would be helpful for me if anyone on the current Zoom call, if you could just go ahead and log off. Anybody remaining, I'll put in the waiting room. And then we'll go ahead and start the conference call information and we'll have people log in there.
All right, see you on the phone, guys.
Welcome to the Conference Nation conferencing service. Please enter your number. Please hold while we place you into your conference.
I'm seeing 9 of us, so we'll reconvene the meeting. Picking up on our agenda. I think we are to Executive Director report, are we not?
Yeah. Deb, I'll go ahead and I'll do a Executive Director's report, and I'll try to keep this somewhat brief. There's been a lot of things going on, but I understand the time limitations. So one quick thing, the BSRB YouTube channel, we launched it in January. Currently, we have 18 videos are streamed or uploaded. They have been viewed a combined 322 times. So I just wanted to mention that for the board. I think as a public protection agency, it's helpful to know how many people are getting access to the information that we're putting out and the news that we're putting forward. So I was pretty happy with that number, 322 and counting. And so I'll keep updating you as we have more views and more information is going out. In terms of revenue and expenditure information, so the state fiscal year runs from July 1st to June 30th. We are currently in fiscal year 2021. At the beginning of the year, the balance in the BSRB fee fund was about $2.2 million, and the agency receives funding from licensure fees primarily. There's also a 10% of any revenue that we bring in that goes to the state general fund for administrative costs and other things. The yearly revenue was projected to total about $691,000 after the 10% reduction. So far this year, we've been averaging about $58,000 in revenue per month. We were a little lower before the last month, but that came in about where we wanted it to be. So based on the year, we're right about in line with where we thought we would be based on the revenue, as long as it holds consistent the last 2 months of the fiscal year. The expenditures have been coming in about $76,000 per month, which is higher than revenue, but that is somewhat by design. The board lowered fees for licensure a couple of years ago. However, the expenditures are coming in below what they were estimated prior to the start of the year. We have some encumbrances that also need to be factored in, but I think looking at everything, expenditures probably are going to come out to around $900,000 this year. They were budgeted for about $950,000, so we should come in under budget. There have been a few savings related to the pandemic and other expenses, but I just wanted to give you a big picture perspective on the budget. In terms of overall items for the agency, all the staff have had access to the COVID-19 vaccines now, and we are continuing to have staff work partially at home. We're still waiting on direction from Department of Emergency Management, Department of Administration for further direction, but we're evaluating things on a case-by-case basis. We have made a couple of upgrades in terms of technology. I talked to you previously about we having some difficulties with some of our computers that were past their time to be replaced. We have made 3 replacements of laptops in place of desktops. Those are for Leslie, myself, and Joan. And these are through agreement with the Office of Information and Technology Services. We've also got docking stations, so these laptops can be used at the office or at home. So they should be allow us greater flexibility in the processing time, and normal day-to-day operations has improved. I've heard feedback in regards to that. In terms of phone updates, prior to my arrival, no members in the staff had cell phones. We had trouble with individuals working from home being able to call securely to the public. We did go ahead and make the agreement to go ahead and do cell phones for Leslie and myself. So we now have cell phones that allow us to check email and do things. This will also come in handy later on this year when we have the offsite meeting in Kansas City, because we can use one of these as a hotspot to go ahead and stream for the public at the meeting. So this will allow some greater flexibility, and I think it'll be helpful in terms of also keeping records for this information too. We did manage to get Jabber technology for the staff. So now they have that on their computers and they're able to make phone calls from home securely using that technology. In terms of legislative updates, we'll be talking about those bills a little bit later, but I wanted to let you know that our budget was approved for fiscal year 21. It was also approved for fiscal year 22 and 23. The budget for 22 is roughly the same amount that was approved for the 21 budget. The fiscal year 23 budget is slightly higher by about $10,000 due to some other technology that is scheduled to be replaced. There's a bill 2066 that involved military service members and military spouses and licensure. When that bill was originally submitted, based on what the initial bill would have required, we had submitted a fiscal note saying that implementation of this bill would need us to have 2 additional licensing staff members to meet those timeframes and do a lot of the work on that bill. There were several changes, and so the last version of the bill, we produced an updated fiscal note asking for expenditure authority for a half-time staff member to work on licensure and help us meet those timeframes. And we did get approval for that from the legislature in the omnibus appropriations bill. It came out to about $20,000, which included salaries and fringe benefits, but also equipment for set up an individual. So that is something that we have received approval from the legislature for 2022. Unfortunately, when we submitted that revised fiscal note, we indicated this would start in 2022 and continue into the future. The legislature in the omnibus appropriations bill only added the expenditure authority for fiscal year 2022, but not 2023. Most of the budgets are only approved for 1 budget year, but the biennial budgets have 2. So if this is needed for the future, we will have to request it as a supplement for the fall. So that is something we'll have to monitor. And then the BSRB legislation, House Bill 2208, it is listed under old business, and we'll go through some of the implementation aspects for that. But that bill did pass. One of the last changes they made in conference committee was to change the implementation date from the statute book to upon publication in the Kansas Register. The statute book generally comes out sometime in July, but this was bumped up. The Register is a weekly publication, but it had not been published as of earlier last week. It did come out and was published in the Register on May 6th in the afternoon. So it has been fully passed now, and we are working on implementation steps that we will talk about later. In terms of other bills for the BSRB, there were several others that dealt with licensure. We've talked about most of these bills in the past. The SIPAC bill, I just want to let you know for reference, in the past, we've referred to this bill as 2209. The final bill was put into a conference committee report, and that was Senate Bill 170. So we'll talk about that a little bit later too. Information on regional and national meetings. When I applied for this position in the fall, and I spoke to all of you about my background, I told you about my background and that it wasn't in these particular fields for the BSRB, but I wanted to let you know that if I received this position, I would do my best as time allowed to really try to learn more about all of these professions. And I wanted to let you know, since the legislative session has calmed down a little bit, I've done my best to sort of immerse myself in these meetings from the different associations to try to learn more about the aspects of the professions. So I've noted some of the dates there, some of the different meetings. Just wanted to let you know there are some efforts that I'd be happy to talk about with you in the future that the national associations are talking about. There, in particular, there is a compact for professional counselors that we went ahead and provided model language to the Professional Counseling and Advisory Committee to review, and Jan did a walkthrough in terms of that potential compact. It is a brand new compact, so it doesn't have much history on it. Also, later this month, I believe it's on May 20th, there is a kickoff meeting for a social work compact to go ahead and just start the idea and the formulation of the process for that. So I plan to attend that meeting. I've already registered to sit in and just observe, but those are 2 compacts that I'm aware of. So again, I'm happy to talk about any of the rest of these items, but I know time is short, so I'll go ahead and skip most of the information that I've learned from those, but those have been very beneficial and educational meetings, and I will continue to sit in on those as time allows. And then at the end, I just went ahead and noted some of the speaking engagements that Leslie and I have been able to talk to different groups of students over Zoom and other platforms, and that has been really helpful. We've got a lot of good positive feedback, and also we've been doing our best to direct them to the YouTube channel to continue to get updates on the professions. There is an item I wanted to reference for you. If you would still like to see attend training for new board members with ASWB, there is a session available. It's June 10th and 11th, and it is free. It's online. If you're interested in doing this, please reach out to me, and I can help connect you with ASWB or register you for the event. And then also I want to give an update. At one of the last full board meetings, there was discussion about having the offsite planning meeting for the board, the one that is typically done in the fall. The board agreed to have this meeting in Kansas City or Olathe on September 26th and 27th. I will have gone ahead and booked, I put a block in of 15 rooms As we get closer to that event, early in February, we can do confirmations on board members if you feel comfortable attending that in person. But I wanted to let you know that we have gone ahead and talked to the hotel and confirmed a block of rooms. We don't have to pay for those until we have a more accurate head count, but that is in the works. So happy to answer any questions you might have.
Okay, very good. Staff reports?
None at this time.
Okay, thank you. New business. Governor's order, Executive Order 21-20 concerning expiration of occupational licenses.
Yeah, and I could speak briefly to this issue. So during the pandemic, the governor and then the legislature have declared states of emergency related to the pandemic and issued executive orders to correspond with these states of emergency. And one that has the BSRB has been experiencing has been an executive order not to expire professional licenses while the disaster declaration or the state of emergency continues. The last of these was set to expire on March 31st. There was a thought based on conversations that I had heard from other individuals that this executive order may not continue past the date of that March 31st expiration. There was another state of emergency that was continued to May 28th. And then on April 1st, the governor did issue an executive order to continue it. But the language was a little bit different, but it was kind of confusing in regards to some of the conditions. So as I understand it, other agencies continue to meet with the governor's office expressing concern about the continued delay of expiration of licenses. And so the governor did issue another executive order, and that executive order is Executive Order 21-20. And what that executive, sorry, 20,
It's actually 21-22. It's just a typo.
Gotcha. Okay. 21-22. You were correct. And that executive order changes a lot of the previous language that said state agencies shall extend renewal deadlines or shall extend deadlines for continuing education requirements, and change them to state agencies may renew or extend renewal deadlines or for those things. So it provided more flexibility to regulatory bodies that they could do this if they chose to do so. The language also in the executive order indicated that any entity that wished to go ahead and cease continuation of this delay on the expirations, if they took action to do that after publishing information either on the website or sending it out electronically, it would be 15 days after that notice was provided. So what I wanted to do was to make you aware of this new executive order. This one does rescind the previous executive orders. So this is on the books. This one is set to expire on May 28th, which is a little bit longer than what we had, 15 days. But it sounds like we may be getting some feedback, but so basically what we wanted to bring to the board to you was just kind of let you know the experience of the agency in regards to these license renewals. We think this was helpful for individuals during the pandemic, but I think recently as more things have started to move to opening back up and taking steps to do certain things, it has been a little confusing for some of the licensing or some of the individuals who have professional licenses as they are hearing that these are going to expire and then they don't, that the new executive order is issued to continue these out. And I don't believe we received many comments, if any, from the public that have requested that we support continuing delaying the expiration of these licenses. So I just wanted to let you know from our perspective, what we have heard from other entities is that they are going ahead and requesting that their boards go ahead and choose not to extend this past the May 28th date. And if that would be your choosing, what we would ask is that if there are future actions that provide this similar language, if you could let us know your preference on those, that if another one is extended in similar language, just letting us know if you would like us to go ahead and have the office go back to normal in terms of the expiration dates after providing notice, or if you'd like us to do something different. But we wanted to bring this to your attention and see what your thoughts were and take direction from you.
Thank you. Board members have comments, questions? We have a decision to make.
Well, I would
Can I play the
support
Jeopardy music?
Carolyn, are we to discuss now? I would think that no further extensions would be needed at this point, would be my opinion.
Okay, thank you.
This
I
is,
agree with that
I
as
would
well.
agree with Carolyn as well. I don't see any need for further extensions.
Is there a board member then who wants to make a motion that pursuant to Executive Order 2022, that staff notify the licensees that the extension date to renew all licensures that have expired since the March 12th, 2020 pandemic the deadline will be May 28th, 2021?
Quick question before that. Do you guys have any idea how many are outstanding at this point past their, what would have been their due dates?
So what makes that challenging is that there's really no way. Most individuals let us know that they just have decided to continue or have decided to stop practicing in general. When we sent out a message prior to the last expiration, we did see an increase in people who went ahead and responded to that. So we believe that there were some. Looking at month-to-month revenue after the revenue came in from April, we are about on pace. So I believe that there are likely some. I don't know how many of those, it's just hard to tell right now how many of those have people who just decided to stop practicing versus people who are just late in terms of, doing their renewal.
Very good, thank you.
Okay, so Jan had proposed language for a motion. If anyone would like to make that motion. Or
I just have a clarification. From what it sounded like she said, that means that these licenses would expire in 11 days from today?
May 28th would be 18 days.
Okay, I'm sorry. I thought I heard 21, but so 18 days.
Well, if I misspoke, it should be May 28th, 2021. So he would probably need to get the notification. If that passes, then the notification would have to go out in a matter of just a few days.
Well, and just to let you know, when the last executive order was put out to extend it to May 28th, we did send something out and we put it on the website. So the website has the current information that is set to expire on May 28th. So our letter out to individuals would be confirming that we have already provided notice of this. The board confirmed it would be, the will of the board that this would, the executive order would not continue past that date, or cleaner language than that, but essentially that we'd already put it out there that May 28th was going to be the expiration of the licenses, and we're confirming that based on the board's action today as well.
It might be good if that new notification were to have the date that you had the earlier notification, because I can just imagine some people, I don't want to use the word whining, but commenting that 18 days is pretty short. So not that anyone would whine about such a thing.
It would be essentially saying that there would be no more extensions. Even if the governor did one, right?
Well, and this would only change really is if, let's say that something happened where the pandemic, there's an unexpected spike, and the new executive order would change that language from this. It wouldn't be may, it would go back to shall, because then it would really be outside of our hand. But should it continue, if they issue another one that has similar language, if it's your position, we would go ahead and say the board has weighed in on this, given the flexibility, and so May 28th is the date that these are going to be held to be expired.
Go beyond May 28th, the legislative committee who looks at the emergency disaster proclamation, they have to meet to extend it beyond May 28th. Right now, it ends May 28th, so nothing's going to happen unless they extend it. If they do extend it, then the governor kind of is in the governor's decision then as to whether or not she wants to change the orders because there's been a spike so that people get this break again. But then once she issues that order also goes back to that same legislative committee to see if they want to basically revoke it. They now have the authority to stop any executive order. So it's a little bit more of a process now, but yeah. So consequently, I don't see that it would change before May 28th unless, they would meet again because of some spike and extend it further.
And I'm happy to make the motion that Jan mentioned just a few minutes ago.
Whatever it was.
Whatever it was.
For a
I'll
second.
second.
And I second it. It's Carolyn.
Got lots of seconds. Any further discussion or questions? All in favor, say aye.
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 Any opposed? Okay, motion carries. Thank you. Next item, clarification for person-to-person supervision attestations during the pandemic. So I believe that we may have a motion someone would like to make for this.
I would. This is Mary. I would make a motion that we direct the staff of the BSRB to change the attestation under the new requirements in accordance with House Bill 2206 as for all applications on or after May 6, 2021.
And Mary, just clarification.
2208.
Yes.
Sorry about that.
It's 22. Yeah, it's fine.
Second.
Okay. Any discussion? All in favor, say aye.
Aye. Aye.
Any opposed? Okay, motion carries. Thank you. Consideration of continuing education requirements in diversity, equity, and inclusion.
Deb, can I go back one? I have a note, so I just want to just make sure we might need another motion on there too. I'm thinking that we should make a motion to direct staff to also start working on temporary regulations. So I would make a motion. I would make a motion to direct staff to begin the process of working on temporary regulations, also in consideration of House Bill 2208 for all changes on or after May 6, 2021.
Second.
Any discussion? All in favor, say aye.
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 Aye. Any opposed? Good addition, Mary. Motion carries. Now we can talk about continuing ed requirements of diversity, equity, and inclusion. David?
And I just wanted to say, so this is a topic that has come up at some of the national meetings from the different associations. There has been pushed by other states to consider changing continuing education requirements for different professions so that there would now be a requirement that a certain number of continuing education hours would be under the topics of diversity, equity, and inclusion. And so this has been a conversation at the national level, but I also understand that some of the advisory committees have also had this discussion as it may relate to the professions in Kansas. So just wanted to go ahead and note that here.
Okay.
This is Rick. As David knows, we did talk about this in the Licensed Psychology Advisory Committee and proposed some language that we would recommend adding to our continuing education regulation that would support this. There was some question about whether it would be possible for someone to use the term we used during the meeting, double dip. So if someone happened to go to a CE course that was on the ethical application of dialectical behavioral therapy in underrepresented populations, that might count as both an ethics CE and a diversity CE. And our advisory board felt like that was okay, as long as there was something you could point to that addressed both ethics and diversity issues.
This is Mary. The MFT Advisory Committee had a very similar discussion as that. They wanted to make sure that the language was written in such format that we could count them in other areas. There was also some comment about ensuring that the language of what the CE requirement would be is diverse enough so that it could account for, let's say, rural and frontier as a population that would be included. Sorry, I'm getting some feedback. So, but the MFT Advisory Committee was in support of this.
And I should note too, so in terms of a change that could happen, Leslie and I have talked about this, and any modification would need to be a statutory change. I think there might also be some regulatory things too. So, so the earliest that this could, take place would be if there was a bill that would be put forward by the BSRB or requested by the BSRB for the next legislative session. But since this conversation was happening, I'm going to go ahead and bring it to the full board's attention for discussion.
This is Deb, and I guess I just have a comment about this topic. I'll start by saying I'm 100% for those topics. I'm curious as to whether the board can figure out whether we're in agreement about what we're really hoping to accomplish by requiring these topics. Because by making it extremely broad, I don't know what we're accomplishing. The double dipping, that doesn't bother me at all. Because honestly, when I very first saw this topic, I'm like, okay, well, this is in line with our times. This is to acknowledge the complete lack of education that, frankly, 90% of us have had about people of color, their experience in the world, the history that has been completely erased from school books and et cetera. And I don't expect one course to correct all that. However, I also just heard in the commentary that we're considering it to be a lot broader than that. So I just think as a board with regulations and statute, we need to be very crystal clear, at least at the time of our intention, why we're requiring it. Because the first thing that occurred to me was just like diagnosis and treatment. That's broad, and I get it why we have it, but there's a lot of things that can fit under it. And frankly, there's always questions. Does this course count? Does this course not count? Right? And so that's all I want to say about that is if we want to really get serious about, and if that is really what our topic is about, because frankly, if it's not about that for me, I'm not going to support it. But if that's what the topic is about, let's be crystal clear and make sure that we have some way of pointing to that so that we're not quite so ambiguous like we are with other things.
This is Carol, and I tend to agree with Deb, but I think in our social work advisory, we only got to talk about this briefly, and I support talking about it again because we meet next week. But we felt that, but in our code of ethics, it is real clear that diversity, exclusion, equality, all that is very clearly outlined, and we're to adhere to that when we practice. So we felt that it was under ethical standards. It's just one of those. It was just a given, and we've been in our education. We had that in every class. It was interwoven in every class. I mean, we practically could recite the code of ethics by the time we left the school program. But anyways, I tend to agree.
I guess my comment to that is because we had similar conversation, particularly, and I think I referenced diagnosis and treatment as an example of where sometimes our intention goes a little bit awry. But there's more than the BIPOC population right now that would need some cultural responsibility as it comes to education. So I guess that's where these things, I hear your point, Deb, and I think it's a very well-intended point, which is what is the mission of it? If it's about ethnically diverse populations, then let's spell that out, because I also think there's for LGBTQ. That would be a pertinent population. There's so many populations right now where people need to educate themselves, particularly in the treatment of those folks. So that's where I think that dialogue came from our group. And then someone did in particular talk about the frontier areas of our state.
The only state that I've seen something very specific on about in their CEUs is Alaska has a specific CEU requirement on indigenous populations. And that's the only state that I've seen something that specific on.
So I assume we're going to continue to have these discussions, and I think this would be a fine topic for the offsite planning meeting if we want to consider putting forth some sort of statutory change.
Sounds good.
Okay. Next item, review and consideration of continuation of licensing database agreement. Someone want to make a motion regarding the, I'll call it a sample contract we received?
Sure, this is Mary. I would make a motion to direct the staff, in particular David, to work on working out the terms of that agreement and having the authority to move forward. That was a little clunky.
I think it was clear.
I'll second. It's Leslie.
When you say authority to move forward, are you saying authority to sign it or just to engage in negotiations?
Thank you for that
clarification.
Sorry, my space bar wasn't working all of a sudden. My intention in that is that he could execute the agreement on behalf of the board.
I still second it.
Any other questions or comments?
This is Rick. I just have a question. When she talked about the level of review, and it sounded like there had a preference for just looking at the course descriptions, is that?
Oh, this is for the licensing database.
Oh, I'm sorry. I apologize.
Yeah.
Sorry.
This is with Board of Healing Arts. Any other questions? All right, all in favor, say aye. Aye.
Aye.
Any opposed? All right, motion carries. David, do we have a place to go back to the other agreement based upon?
There is not a specific line item on the rest of the agenda, but a motion could be made at any time if a member of the board has thoughts on the other contract, potential contract.
Okay. We would like to have some discussion and possible action on the other speaker we had and the contract we looked at. We could entertain that to amend the agenda to add that. Or we can wait till next time. Although, one of the comments I guess I'll make is that we have some pending applications that have been pending for quite some time. And we appear to be running out of options.
I think that I've talked with Leslie about that, and all those ones are going to be put in the CAPA your CAPA proceedings. I think we may have a way to deal with at least some of those. Is that right, Leslie? That we're going to try and gather all those up for the next CAPA?
Look at them, yes. And then bring the ones that are that meet the requirements or don't meet the requirements Jan and I were talking about.
Yeah, where you've got a response back from the educational institution on whether the educational institution themselves meet the requirements. looking over the regulation, we may be able, based on that information, to resolve some of those rather quickly.
I'm going to contend that time is still of the essence.
It is.
Since we don't meet every month, so.
Well, I think it's important that we can find out if they're open to some contract changes. So I think that would be a motion that we should put forward, is to have David start there with potential contract language changes. I mean, I would be open to saying to make a motion to direct staff to begin working on those changes, but I didn't know what everyone else felt.
My question was whether we were going to amend the agenda to add that as a discussion item.
Oh, sorry.
I was going to make that motion, so that's Leslie. I can move that we update the agenda, amend the agenda to have that discussion.
Mary will second.
I will. I'm in it.
And I also agree with Mary that I think we can move forward in having staff look at those changes. And I think Deb, you would be included in review of that contract as one of the board members, I think the chair.
All right, well, let me call the vote on amending the agenda first. All in favor, say aye.
Aye.
Aye. Any opposed?
Aye.
All right, let's just go ahead and talk about it right now.
Sorry.
All right,
along.
so we have a motion to direct staff to look at some review with council to review the contract further to see if they would be open to those changes. Before I call a vote, I want to open it up for discussion and make sure we're all on the same page that this is something we ought to pursue. Talked about it a few times. We didn't have the details. We didn't have anybody coming and talking to us about what it would entail.
So this is Rick. So back to my question when I was mistaken on which contract we were talking about. So her discussion of the review sounded like it would be primarily of catalog descriptions of courses. I know that when I have reviewed these for licensed psychologists and I compare catalog description with syllabi, sometimes they gel and sometimes they don't. And so I was just wondering about thoughts of whether that kind of review was adequate, and whether people outside of the profession would be able to appreciate whether something was meeting the spirit of the regulation.
This is Carol, and I agree with Rick. I also think that the catalog descriptions are extremely brief, and you would really definitely would have to go through the core syllabus, which takes a lot of time, but that's really how you answer those questions. And so to me, if you could find someone that is willing to do that and has the expertise in every profession, you know, including social work, you know, all professions that serve on the board, I would agree that'd be very helpful to have this board, for our board.
But you do have the ultimate authority to decide whether or not a course meets the requirements. But again, you know, as she said, things were willing to be negotiated. So you may want to decide if that's something that you want to be in the contract, that it's not based solely on the course description, but it's based on the course description and the syllabus.
Did she not say that? I guess
That's how I understood what she said, that if the description was shortened, they would dig further. That's how I understood.
I think if they're satisfied that the course description is sufficient, they make it on the course description. But she said oftentimes the course description is about 2 lines long, which isn't enough. And then they ask for the syllabus.
Yeah, she did say that. I think my concern is a little broader than the length of the course description in the catalog. I know that when I have in the past reviewed things that were from unaccredited programs, some of these places can put whatever they want in the course description, and then you look at the syllabus and it is frankly not what was intended, I think, by the regulation, right? And so it sounded to me that the preference is to use the course description, which I understand for expediency. Their job is to make money. And in order to make money, you have to be efficient. And that is the most efficient way. It's also not necessarily the most accurate way. And so if we have concerns about accuracy, I think that looking at a syllabus is the correct way to go to determine whether the course does what the course, I teach, right? I teach at KU. And you could look at the course descriptions, or you could see what I actually do in the syllabus, right?
Mm-hmm.
And so
that could be a contract change.
Mhm.
She's not there. We're not going to ask them to do very many, right? It's outliers. So they should theoretically have time, at least for our book of business. We're not having them review every single file, every single applicant.
I'm wondering though, if she would want to increase the $50, that's not a lot of money for, when you really do a thorough examination, you're talking about a lot of work and much more than 1 hour, it's what I think of $50,
It's 150.
Oh, 150. Oh, okay. Oh. 2 hours.
And was it just for those people whose programs didn't meet that counseling accreditation?
Yes.
Yeah, and that's kind of the arrangement. What's most similar is what they do currently with North Dakota, where North Dakota sends them a handful of applications each year that are sort of that fall into this category for individuals who didn't have their education from a accredited institution for the national accrediting body.
KCREP.
KCREP.
Other comments?
And just for my clarification, we're only talking about this for the licensed professional counselors at this point?
That's all the contract at this point covers. That's what one of the questions was, what did you want to make it broader to cover other professions like psychologist, or just every profession you have, or all the licenses that you have?
I wouldn't be able to vote yes if this was to include licensed psychology right now. I didn't feel that comfortable.
I think what we have pending are all professional counselors right now. Is that correct?
Yes.
Yes. So if we just move forward like that, we would have to amend the contract in order to allow for any other professions.
Or get a new contract to cover those additional professions.
Okay, I'm going to call the vote. All is in favor of the motion to proceed to have staff work out contractual changes as needed, as directed by our attorney, say aye.
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 Any opposed? All right, thank you. Next, records of deceased practitioners. David?
Okay, this was something that the board had talked about at the last board meeting in terms of individuals passing away if they're a single practitioner. And so the two items were, what happens to the records, who would take responsibility for those records, and then how would the process work by which individuals would be able, clients would be able to obtain their records. And so this was an item provided to the advisory committees to have discussions about, and then bring back any thoughts or recommendations. And so that's why it's appearing here on old business.
Okay. Does anyone have any comments about that?
Well,
Go ahead, Rick.
Well, just briefly, we talked about this some in our last meeting, last month, I guess, April, and wondered whether it would be possible at the time of license renewal for professionals just to indicate to the BSRB who, at least for psychologists, who the psychologist has designated as the holder of records upon their death. This is already in our ethics code that psychologists will have made some provision to deal with the records after I'm gone. And so we didn't feel like it was necessary for the state to take possession of those. That kind of sounded horrible to us, but rather that if I identify to the state who I have left my records to, that would achieve all of the goals that I think we felt like were important.
I was just going to say, in our last advisory meeting, I don't believe that we had a chance to discuss this item because we had Jan in our meeting kind of extended time. So hopefully this week we could continue those discussions. I know that as an individual practitioner, I just attended an ethics class on documentation, and it encouraged that you're to keep everything basically, but if you can't do that, at least keep summaries of each record. So it's kind of up to the agency or the individual practitioner if you're in private practice to do so. Beyond that, I don't know.
The MFT committee started this dialogue. We didn't complete the dialogue. We did go down a path similar to what Rick was saying about how that would be implemented, like a renewal question or something like that. But we decided to pull some resources together from other entities so that we could just get some sampling of what would be required for people to do that. So we're still, it's on our next time agenda as well.
That would be another topic that would be good for the off-site planning once folks have really had a chance to talk with their advisory committees. All right, next item, consideration of changes to in-residence.
Okay, so you have some materials that were forwarded to you. The board has discussed in the past about the definition of in-residence, and there was, individuals have asked the board to look at the definition of in-residence in the past. There is a specific letter from an individual named Hannah Shirley that's in your packet talking about her thoughts on in-residence and other items concerning licensure. So the board previously had requested that we reach out to individuals at educational institutions in Kansas to ask them for feedback on any potential changes to the in-residence rules. So I worked with Leslie and we put together a letter to go ahead and send out to individuals from those colleges and universities in Kansas that have programs. And you have a document from us that was sent on behalf of the BSRB. And then following that, you have, I want to say about 8 to 10 responses from individuals at those educational institutions speaking broadly to this topic in general. And I think there was a nice variety of responses from both the different the schools and also the different representatives from the professions for the BSRB. So I wanted to go ahead and provide that for you for your review and future conversations if you wish to look at any potential changes to the residence requirements that are currently in statutes.
At the risk of turning our off-site planning meeting into a 2-day event, let's add that to the, and hopefully folks can start to articulate some thoughts about that. There's kind of this polarity happening. Absolutely not. Absolutely. So I would encourage us to be thinking in the middle somewhere. Again, I'm just going to say, I want us to be in front of this. We know where the wind is blowing across this country about regulations. So all I'll say about that. Next, review of legislation and considerations for implementation. House Bill 2208. David?
Yes, so House Bill 2208 is the bill requested by the BSRB. Kept you guys updated as best as I could in terms of actions on this bill as it went through the legislative process this year. The final version of the bill included about 5 or 6 other bills that were amended into the bill. And throughout the entire process, it was to become effective upon publication of the statute book until the very end of the conference committee, in which they changed it to upon publication in the Kansas Register. And the Kansas Register is a weekly publication of the Secretary of State's office. And that was published this past Thursday on May 6th. So the Register has published this information. And so Leslie and I have been talking and going through the different items that were included for the BSRB in the bill. We did walk through and try to determine some of these changes. So there are things that are changed that are included in statute that are also included in regulation. And so the bill changes the statute, the regulations will need to be modified. It's our understanding that where the statutes and the regulations are in direct conflict, the statute should prevail. So in instances such as the decrease for the postgraduate work experience for many of the professions, changing from 4,000 hours to 3,000 hours. If the regulations also reference the old numbers, we would go forward with the new numbers because these are in direct conflict. However, if there's cases where they may not speak directly to that item, we would need a little clarification. And there's also a couple questions we wanted to ask for the board in terms of people that have existing agreements or existing ways of training plans and other items that we wanted to get your direction on, specifically for the training plans. As I have talked with Leslie, it sounds like when the change was made for social workers a couple years ago to decrease the hours for those, and also for the dropping down from 150 to 100 hours for the direct supervision, it sounded like at the time the board had a position not to have individuals submit new supervision plans, that they would just recognize the new standards. And so Leslie and I wanted to bring that to you, that if there are individuals who have current plans we wanted to get your position to go ahead and see if we should do the same thing we did with social work a couple years ago. But we wanted to bring that to your attention and get some guidance from you on that topic.
Specifically that, like Dave said, they would not need to submit training plan amendments because that would be horrendous. It would be such a large amount. I mean, for Joan,
that's your objective opinion, right, Leslie?
Yeah. And so no training plan amendments unless, changes that they need to do. And then they may be, obviously, based on what you said earlier, reviewed under the new requirements.
This is Mary. I completely agree. People should not have to submit new training plans, and they should just be held to the new regulation or statute.
This is Carolyn. I'm in agreement with you on that.
Anyone disagree?
I agree. Yes.
I agree as well.
I agree as well.
Okay, then we will go forward, seeing this as a consistent process as what was done in the past when the other changes were made. And so we plan to send that to licensees, post information on the patient of the bill. Sorry, I'm getting a few. But
you keep cutting out a little bit. I can't hear.
Yeah, we intend to send out information and post it on the website, but we also want to address some of what we anticipate to be the frequently asked questions. So we want to make sure we cut those off. So we do plan to go ahead and send an email out to licensees and also post to the website. And I've also thought about going ahead and putting together sort of informational video that we can link to the YouTube channel. And so that way we can direct people there for maybe a little more the conversational approach so they can hear some of that information. So in terms of some of the other items we wanted to get your feedback on and direction from. So one of the items included in the bill has to do with the changes that were made to the individuals who get a temporary out-of-state permit to practice. Some of the changes that were put into this involved changing the number of days from 15 to 30 days. There were also some additional requirements that had to do with individuals if they could qualify for this, such as 2 years of prior practice in their jurisdiction. There was also a form that they would need to record which days they did in-state practice, different things like that. We would just like your direction on this one because there are several changes in terms of who might qualify. So, we have individuals who currently have are in an agreement based on the old standards. And with this change, it would allow new terms based on new qualifications. So we would kind of like to hear from you, if there are individuals who currently are under the 15-day, do you want us to allow them to try to move to the 30-day, or do you want us to treat that as individuals who are applying new? Some of the things to weigh in this is that there was really no requirement to note which days of in-state practice they had before, and there were old conditions that now we have new things in place to qualify for the temporary out-of-state permits. So it is a little bit different in terms of the two standards. So I just wanted to allow you to have some discussion on this if you would like, but wanted to get your direction on how you would like us to treat individuals who currently are following one process that may wish to switch to the second process.
Okay, I think I may have lost something. Are you talking about House Bill 2066?
No, this was still a BSRB bill. Some of the changes were, but there were changes for the qualifications for temporary out-of-state permits. And so we just wanted to know how to treat individuals who currently have an out-of-state permit who may want to go to the new, moving from having 15 days of in-state practice to 30 days of in-state practice. If you want to say anybody after this point, we're going to apply the new standards to, or how should we apply the standards to the people who currently have one of these?
We also, if I remember correctly, the renewal date changed as well. Is that correct?
Yes, the renewal date under the old system was to expire at the end of the calendar year, no matter when in the year you received it. The new one would expire 1 year after obtaining it. So there's a difference there as well.
The new language that we're talking about, you can see an example of it for the clinical professional counselors begins on section 15, which is page 11 of the House bill. It's pretty much the same for all your professions, but that's the example now of what the temporary permit looks like.
It seems like for the point of clarity, it would be from this point, at the point that the law was passed.
Yeah, and we'll be applying the new standards to anyone who applies to the BSRB for this now.
Okay, so you're talking about ones currently in existence.
Right. Mm-hmm.
So I'm sort of the opinion then that they would get their 30 days now. But I'm probably not familiar with administratively how that impacts your office if you want them to reapply and then be under the new standards.
So when someone, in the old statute, if someone was to request to extend it for 15 more days, we would have them send a new application and a new fee. And then just, use it as an extension. So they would have to send a new app either way we went.
So could you send like some type of notification to those folks that says you now have, based on this law that happened, that it was enacted May 6th, you have 30 days versus your previous time, and your renewal changes now to this date? Is that too difficult administratively?
No.
The problem I see is that their license says it expires December 31st, that they're currently under, and they've paid an application fee good for the entire calendar year of 2021. So you're going to have to be very careful that you don't at least shorten the expiration date, because they've paid already for the year 2021. This would apply only to people who apply since the May 6th date. They did not put a grandfather provision in here. A lot of times when they change this stuff, you'll see them add a provision that the licenses that are already, or like in this, the permit that's already in existence will continue under the same current terms and conditions until the expiration date. There's no grandfather clause in here, so it's kind of unusual and kind of a conundrum. But if you're going to give them the 30 days, and they've also got to start putting in their reports where, now they've been practicing for 5 months and they weren't maybe perhaps recording their time to comply with the report.
So it sounds like we do need to notify these folks that the law has changed.
You're muted, Mary.
I don't know why my space bar sometimes works and sometimes doesn't. So just in consideration to what you just said about that, maybe an easier implementation is when they renew or they extend, they fall under the new rule. Because I don't know how difficult that would be with that expiration date if they've paid through the year, and I don't want to be unfair to people.
I guess it kind of begs the question, do people want to come under the new law? Maybe they only want the 15 days and no reports. You're assuming that everyone wants to come under this new law. I think if they wanted to come under the new law, then they would have to apply to come under it. So
that's kind of where I was going, about a letter to all of them notifying them this is what you're currently operating under. If you want to operate under the new law, we will need a new application.
Okay, we can send something like that out.
But then moving forward, they don't have the option any longer, correct? They don't have the, okay.
Once the current license expires, they're going to be under the new one.
Okay.
Okay, so there was also, so it said on they'll report their hours on a form approved by the board. So we'll go ahead and we're working on a form for them to complete these hours on, which will be provided to them. So we'll add that to the website. And there's a lot of other things that we have talked through that might require some changes to, regulations or the FAQs currently on the board's website. So we're going in modifying forms and making a lot of changes behind the scenes. So for most of these changes that we have full control over, our tentative time frame is we're trying to make as many of these changes within about a week as possible so that everything will be up to date on the board's website. For some of those regulatory changes, we have the motion that the board made earlier today to move forward on those things. So we will look to identify what we can put into temporary regulations, and then we'll work on the other full regulations where there's a direct conflict with statutory language. One of the items that had to do with supervision said that the board might waive, or the board could waive, the requirement of face-to-face supervision under extenuating circumstances. And last meeting, so we talked about, we bring back some information on a definition for extenuating circumstances. And Leslie and I did talk about this. There is a definition of extenuating circumstances that is already in regulation. It just applies to other instances of using the extenuating circumstance term. But the definition currently in regulations for extenuating circumstances is that the term extenuating circumstances may mean any condition caused by events beyond a person's control that is sufficiently extreme in nature to result in either of the following: the person's inability to comply with requirements of the regulation within the timeframes established by this regulation, or KSA 65-6405, amendments thereto, or two, the inadvisability of requiring the applicant to comply with the requirements of this regulation within timeframes established by the regulation. And so there is currently a definition of extenuating circumstances. We wanted to bring this to your attention to see if the current definition we could use to pull across to apply, or if you would like there to be some modification in the definition of extenuating circumstances.
And the current definition comes from the application regulations for the professions. And it's in all but psychology, I believe, and behavior analysts. And it's currently being used for someone who couldn't take their exam or complete the other requirements for their application, and they want an extension for in order for them to sit for the exam or finish up anything else that they need. And I did talk to Jan about this, and she said that you can have two different variants of the definitions. You could have a definition for applications, and you can have a definition for client contact supervision in the post-grad regulations.
I was going to say that I don't know how long ago that regulation was written. My guess would be it's been a while, but you still kind of have a undefined term, which is condition caused by events beyond a person's control. When I see that kind of language, it's typically referring to like acts of nature, floods, tornadoes, that kind of thing, that something has impacted their lives, so that they had to stop whatever they were doing and deal with that, or, they lost all their material or whatever. Now they've got to go back and get it, whatever. But so I don't know if when that may be something that you want to define a little bit further, such as it means, acts of nature, such as, that's what it includes. If you want to go beyond that, does it mean that they have had a significant health issue, such as when someone gets cancer and they've got to stop what they're doing and do treatment that makes them ill, or if they have to leave whatever they're doing to go take care of a parent or something, that's the only thing conditions caused beyond a person's control, because going to take care of someone, that's not beyond their control, that's their choice. But is it something that you want to include or not? So, that is probably maybe needs to be flushed out a little bit more.
Well, and I also wanted to weigh into, during the discussions of the bill, as this relates to the new information in House Bill 2208, there were discussions about, all televideo or all supervision for, could be done over televideo for those professions that were included in that, or in extenuating circumstances, the requirement of face-to-face could be waived. And I think one of the things that was talked about in that context was if there are individuals in some parts of Western Kansas where the signal strength is not strong enough for there to be face-to-face by screen, that some supervision could be done telephonically. So I know that was previously discussed. So I think if the definition is considered to be that extreme in this context, I think it's fair for you to know that that was discussed in terms of the committees, to let you know sort of the context of the extenuating circumstances as it relates to the supervision.
Yeah, the waiver is to allow the waiver of half of the hours of the face-to-face upon extenuating circumstances. So that, to me, if you can waive half of it, it's something, that maybe goes beyond.
I'm sorry, the waiver where? In the regs?
In your statute, when it talks about face-to-face clinical supervision, and it says including not less than 50 hours of individual supervision, except that the board may waive the requirement that such supervision be face-to-face upon a finding of extenuating circumstances.
I think that was supposed to apply to both.
And, well, then it goes down to, they've got a lot of things crossed out here.
Yeah, and I mean, our intention was very clear that, I mean, using protected televideo equipment isn't an extenuating circumstance. And, you know, it's just an approved method. It was really the audio that became that discussion point of, yeah, again, rural and frontier areas or emergencies, that kind of thing.
Yeah, that's kind of
correct.
But I mean, it says that, well, it's, I guess, a definition of face-to-face, but you can always define terms. So we'll have to define the extenuating circumstances.
Is there a decision we need to try to come to today, David?
Well, so if, I don't know, that would be, I'm changing the regs, I'm putting in the changes that allow all televideo and the hours and to be lowered and all of that. I think though extenuating circumstances would be in the definitions regulation. However, the definitions regulation also has the definition of client contact, which includes telephonic services, and it is not there now. So delaying it too much would affect people who are applying now.
My question of the way this text is written too is that telephonic may be approved during extenuating circumstances approved by the board. And I'm concerned that someone would have to go through a process to get board approval prior to an extenuating circumstance happening.
Well, they have to apply to have that apply to them to tell us why they couldn't meet the requirement. I mean, they got to meet the requirement. But was it your thinking, Mary, that like the audio could just be something they just tell us, hey, I only got these many hours televideo? Because I mean, I'm not sure what you're
Yeah, I mean, I guess what I'm trying to avoid is, you know, you could write into a plan that someone is in a rural frontier area and that they anticipate because of X technology issue, that's a thing, right? So that's one piece. But if we're saying, for example, today my video isn't working and there's lots of instability on this call today and we're all buffering and all of that, and my video has to go off, that's an extenuating circumstances, but I didn't get pre-board approval for it. And so I guess that's where I'm trying to meet in the middle of that. Does that make sense what I'm saying? If I'm in the middle of a supervision and I plan to have face-to-face supervision or video teleconferencing supervision, but something happens, the internet goes out, can I pick up a phone call and continue that supervision? I didn't get board approval for that. And is that not going to count?
Either that or would your application be changed where they have to put in now the number of hours and say 100, then say, if it was less than 100, explain the extenuating circumstances for the missing hours. And so they would have to make a notation like, well, we started face-to-face. I lost the connection. We had to finish it by phone so that only 30 minutes was by face-to-face. The other 30 was not. So that would be something they would have to explain in their application. And then you would have to approve that explanation. Something like that. Would that work? They wouldn't get pre-approval, but it would become on an application.
They would still have to account for it.
Yeah, they'd still have to account for it at the time of the application if it's not 100 hours.
Yeah, and I think the only challenge there would be a situation where it looks like I'm always doing phone versus what I'm trying to articulate, which is this exception that happens. Short of a pre-approved plan with someone with poor connectivity and they write their plan saying, I anticipate that half my hours will come this way or something, and we'd have to decide whether that was a board approved plan.
I guess when I look at this definition and I think about the circumstances that I would have thought about up until now, it like these are well, hopefully outliers, not one-offs that you can course correct, but things you can't course correct for, like cancer, like a pandemic, you know, a massive tornado went through my shop and my house, whatever. That, I mean, so I'm not sure we're applying it in the same way in our minds. But I don't have any problem with Jan's suggestion because it kind of is a compromise, not
That seemed to
particularly
be
onerous.
the issue of the scope of the extenuating or situation. Are we talking about giant kind of situation? Or are we talking about something that impedes the person getting that done at that particular time that may or may not impact others?
I mean, I think it's possible that Jan's suggestion covers scenarios. I don't want to personally try to get super prescriptive about what the extenuating circumstance is.
So then would staff just bring them all to the board for approval?
Every stinking one. No, I'm just kidding. I don't know.
Oh, no, I'm just trying to.
You know, I think you kind of have to look at that and say, you know, are they making it 50-50 so it looks like they're trying to avoid the 100 hours too? I mean, it's kind of a judgment call if something seems
right,
highly irregular.
Exactly. I mean, the pandemic is a no-brainer, right? We know that affected everyone, every single person,
right,
in school or not school. So could you just bring the outliers to us like you do now?
Yeah.
Okay.
I guess I would think that perhaps David can answer some of the more obvious approvals.
I guess, and I'm not sure if there's an authority to do this, but let me know if that's not. You know, acting on behalf of the board, I was wondering if we have the ability to make any kind of approvals or if you want them all to come to the board. I'm not sure on that process. So.
On the applications, Max made the decision.
It's true, we did.
How many of these are we talking about every year?
We have no idea.
No.
It's brand
It's
new.
very low numbers now. We have this. We have the language now. It's low numbers, right?
Okay.
They don't have to get approved now. Social work can't have any.
No, I know the circumstance is different. I'm just saying in general, he's not had to probably review that many.
Right.
Right. But you're right. We don't know what the impact's going to be on the numbers with the new way we're going about this. I would like to hope it's still low, that we're not going to have pandemics. At least not for a while.
Right.
So,
but I mean, if you wanted to, you could like sort of like delegate that to the board member who's licensed in that particular profession to look at, you know, that one. So, you know, maybe it kind of spreads it across the board rather than, I mean, that would be another solution. But then, of course, you may have everyone interpreting it differently for each profession. So it's
that has
kind of
other things. We've done it that way.
yeah, that is the downside to that. Because I mean, it's good. You can guarantee there will be differences in that. That's just inherent in that kind of a setup. I'm comfortable with delegating it to David. I think he has a good mind for weighing things, and that way there would be at least consistency in one person.
I agree.
he starts to see some trends or something that don't look right, he can always come back to the board for further direction.
Exactly. Anyone disagree with that? Okay, hearing none, we'll move on.
So we just won't change it now. We'll just scratch it. The definition in the regulation.
By not changing it, is it going to delay anyone's application that comes in now?
No, I mean, no, because it will, this is just letting them know what that means. So, I mean.
So this part, we have time to work that out.
Yeah, I'll just put the regs through without it.
Well, I was going to say, if you're going to be doing regulations, I would add it in, because extenuating circumstances without a definition, they're going to argue that what David determined was arbitrary and capricious or something. So I would probably work on a definition if you're going to be doing the regulations.
Currently, hold on. It's there's one in the application reg and then there's one in the definition reg. The definition reg though is very broad. And it says, oh, I went to statutes. But it says like, means any condition that is beyond a person's control or.
Okay, so what you provided to us is something you're suggesting we add.
Well, no, this is from the regulations for applications. So it would be putting the whole thing in the definition regulation.
Okay.
So that because it's used in different regulations now, that it's clear where it,
Okay.
But currently there is a one sentence that says it's beyond your control.
Oh, okay. See, I missed some of this context. So we need to discuss whether we want you to put a definition such as this into the definitions, yeah. My brain's gonna stop working, guys. Low blood sugar. So that we can more readily act on this and defend it if we need to. I would agree. So that's the context I miss. I just assumed we were going to proceed with something like this, and I'm comfortable with the both specificity and generality of it.
Right, so this is what it says now, and then in the past and now, Dave would make the decision for all applications. So it's similar, just.
Yeah.
It's just the current one refers to time frames. So it would need just a little tweaking.
Yeah. So work up a tweaking and bring it back?
I don't know. I don't know what you want me to tweak it with.
You said you needed to. I'm just parroting what you said, Leslie.
I think what she's talking about is probably change at a minimum the word in A1, which it says within the time frames established by this regulation or KSA 656405. Because so that it's clear what time frames we're talking about.
Right. And I was saying, I don't know what you would want that changed to.
Well, extenuating circumstances applies to people not meeting deadlines for application processes, correct?
Yes.
So we need you're wanting to put a definition of extenuating circumstances in definitions.
Right.
So would it not be a little bit more generic and not necessarily have timeframes? Just say,
Oh, yeah. I mean, if you read where that new language is where the language is now coming in, like at the top of page 9, except the board may waive the requirement of such supervision, which is talking about the face-to-face clinical supervision upon a finding of extenuating circumstances. So rather than the timeframes, I think your requirements of face-to-face clinical supervision. Is that right?
requirements of face-to-face supervision.
That's
with
what
the
you're
reference back to-
waiving.
Yeah.
Yes.
So that's what it would
Rather
need to
than the
say.
time frame, it's the face-to-face
Right.
supervision. So, yeah.
So I think we're in agreement that we need something in there to support our intention around the new statute. Anyone disagree? So we'll get some language worked up and we'll bring it back and we'll take board action. Or not.
Okay, well, any other changes for House Bill 2208, I think are already kind of been resolved. Unless you're aware of any other items. Okay, so I think we can move on to the next bill, unless there's any questions.
We're ready.
Okay, so the next bill is House Bill 2066, and that was the bill concerning licensure of military service members, military spouses, and others. So this bill is effective upon publication in the statute book, which is probably going to happen sometime in July. So it's a very confusing bill. We're going through it. There's expedited timeframes for licensure of the military service members and spouses. Another period of time for expedited licensure for individuals who are seeking to establish residency in Kansas if they already have a license elsewhere or similar license. And there's new processes in terms of tracking the amount of time frame and processing those applications. Other regulatory agencies are struggling with the implementation of this bill. They have started to meet, had a meeting, I believe it was last week, where we started talking about how much of this information can we start tracking in IMLO, and in terms of the reporting requirement, how much can we put into the automated system. So we are still working on the steps to implement this bill. However, some of the changes were very helpful that the legislature put in terms of making some of these optional instead of mandatory. So we will be continuing to work on this, but our main priority was fleshing out the terms of the BSRB bill given the earlier timeframe for implementation. So we are going to continue to work on these provisions in 2066 and bring back any questions to you, but we are working on the mechanism to track these going forward and apply the new standard scope of practice instead of substantial equivalent in certain cases too. So happy to talk to you more about it in the future, but that's kind of where we're at with this bill right now. And we're keeping in very good contact with other agencies to make sure that we have a similar approach to it as they do as much as possible so that we're not an outlier in terms of how we're interpreting some of these provisions. Next bill is Senate Bill 170. As I mentioned, this is the SIPAC bill, or at least part of it is SIPAC. It is the conference committee shell that essentially became that bill. There's also another item in there that has nothing to do with SIPAC, but essentially SIPAC was put into this and it was passed by one chamber before they broke for omnibus. And then when they came back, it was one of the last items they did. They passed this late Wednesday of last week. The conference committee did include the proposed amendment that was put forward by representatives from the Kansas Psychological Association, or KPA, giving the board the flexibility to charge a fee not to exceed $25 for individuals who choose to participate in SIPAC and list Kansas as their home state. So that is included in the bill. Right now, the bill has not been signed into law since it passed the conference committee by the chamber's floors so recently. The next step will be for it to be gathered and sent to the governor for review. If the governor does sign it into law, there is a sine die period where the legislature will have ability to take any action on bills that were passed during this time frame. So that's not going to happen for another few weeks. But essentially, I wanted to give you an update on where that's at. As a reminder, SIPAC they changed the implementation date from the original bill. So the earliest it would be implemented would be January 1st of 2022. So even if the bill does pass and the governor signs it, there is still quite a bit of time before it would begin. And on January 1st, 2022, the BSRB essentially would appoint someone to be the representative from Kansas as part of that commission. And there's a few months after that before we would have the deadline to do that. So the first time that the assessments would be charged to the state of Kansas would be January of 2023. So I want to let you know the time frame for enactment of SIPAC, if it is signed into law, is a little bit in the future, but I wanted to give you an idea of where it's at today. So. And unless there's any questions, that's all I have on the update on the legislation. Oh, sorry, there was one other note too. I appreciate the staff time. At the last board meeting, when we talked about SIPAC, there was a question from the board in terms of the average amount of time to investigate complaints regarding the profession of licensed psychology. And so I did ask both of our investigators here to look back and try to come up, as difficult as it could be, try to quantify the amount of time that goes into each complaint for licensed psychology. And they did an excellent job. They looked at the methodology for cases of licensed psychology where they'd received complaints in the last 6 months. They broke these down and tried to estimate how much time was taken in terms of determining jurisdiction, communicating with the individuals, reviewing the complaint, writing the narratives, doing any kind of proofing, redacting, and other things, and also time for the CRC meeting itself. And they estimated that each complaint for licensed psychology comes out to about 9 hours. And this does not include any kind of complaints that might deal with further things in the future, such as if someone appeals or there's a hearing or anything like that. So just in general, for complaints up to the CRC and including the CRC meeting, each complaint for licensed psychology would take about 9 hours of staff time.
Complaint Review Committee report.
Okay. In April, we only had 3 new cases. We closed 15, so we were kind of slacking. We didn't have a whole lot to do there. Total number of cases was 78, so that was pleasant because we've had some months in the past where we were seeing 2 and 3 times that amount, so that's good. As far as disposition of the cases, if you look there, in previous months, everything remains about the same. Number of diversions, number of censures, number of dismissals, all that stuff is pretty stable across the board. So I think the committee is working hard. It continues to get a lot of stuff done. We have a lot of interesting cases, a lot of routine cases, and we get them all done. Are there any questions?
Okay, thank you, Bruce. Professions report. We have from the chat from Rick. He had to leave for another appointment. So he says the advisory committee met on April 13th. They discussed 3 issues: the CE requirements for diversity, equity, and inclusion. They said they're in favor of this. Disposal and/or archiving of records following the death of a psychologist. We suggested at the time of license renewal, psychologists be required to identify the person or entity that will take possession of the deceased records. And 3, changes to our supervision regulation to bring it into closer alignment with the other professions regarding real-time video supervision. Anything to add, Bruce?
I wasn't part of that call, but that sounds like everything he said so far.
Thank you. Social work?
We have our next meeting on May 18th. So we'll have more updates after that time.
Okay.
Carolyn, did you want to add anything else? You're on mute.
Carolyn, if you're speaking, you're on mute. I'm having a hard time seeing your face.
Boy, sorry about that. Yeah, that's, I agree, Andre. We did discuss a little bit about the disparity in distribution of social workers in rural areas and other underserved areas. We'll have continued discussions on that topic. And as well, we talked briefly about adding continuing education regarding diversity or social justice. And we are going to continue to have conversations in that area as well.
Thank you. Master's level psychology.
Yeah, we met, brief discussion on a possible interstate compact for occupational licensure. We also talked about adding a member to our advisory committee. I had sent email to previous chair Larry Salmons to see if he wanted to be on the committee. Did not hear back from him, and I think Dave may have reached out to him as well. We also had a discussion of the changes to post-grant supervision. Dave and I did speak as part of an ethics panel for the Kansas Association of Masters Psychology's recent symposium, and just wanted to tell the group Dave did a great job. Appreciate his willingness to do that, and I thought it went really, really well. Our next meeting is June 17th.
Okay, thank you. Marriage and family therapy.
We met on the 30th of April. We, as discussed earlier, talked about the records of when someone passes. We talked about the diversity, equity, inclusion required CEUs. Legislative updates included the supervision changes in face-to-face. We reviewed terms of our committee members, and we set the date for our next meeting, which I think is going to be in end of June, June 25th.
Okay, thank you. Addiction counseling did not meet. We meet on June 19th. I assume we don't have anything for behavioral analysts. Okay. All right, next item, information on July board elections. So that's actually my item. I've been serving as your chair since January of 2020. I took over for the then chair who had actually was a holdover till her replacement came. I was vice chair at the time. So normally, and I was then elected officially, I guess, in July of 2020. These are one-year terms. So I wanted to bring it up today, just anticipation of the July meeting, that I will not be seeking re-election of my chair position. And so we will need to have that election then. You have a vice chair, or we do, Leslie C. Wester. I think unless she's changed her mind, she is willing to serve in that capacity should the board elect her. So I just wanted to give folks an opportunity to think about that going into July. If anyone is willing to, I guess, run against Leslie or serve as a vice chair, we'll be taking that up at the July meeting. Okay, we're to adjournment. I'd be happy to entertain a motion.
So moved.
Seconded, Carolyn.
All in favor, say aye.
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 Any opposed? Don't you dare oppose. I'm starving. All right, gang. Good work today. Have a great day.
Thank you.
Bye. Thank you.
Bye.
Bye.